So we're delighted that our congregation has been actually singled out to be a part of the blood pressure study that is the Heart 360 that the American Heart Association and the CDC is sponsoring. They actually chose us because of our congregation size and the fact that we're an all African American, well, I would say 98% African American congregation.
My name is Steve Daniels, Jr. I am the senior pastor of the Shiloh Missionary Baptist Church in St. Paul. I am just so delighted and so grateful to have this wonderful program in our church. We have a health and wellness program that deals with people's health. You know, we got to be concerned not only for the spiritual side of people, but as well as, you know, the physical side. American Heart Association partnered with us to bring a program into our community that deals with checking people's blood pressures weekly.
Hi, my name is Kim Friend and I'm the Executive Director for the American Heart Association here in the Twin Cities. The reason why we are so excited about Get to Goal is Pastor Daniels is a member of the Board of Directors here on the Twin Cities Heart Association Board, and we were looking for a place that we could work with a number of individuals on lowering blood pressure. And so this is just a wonderful opportunity to collaborate with our community and to hopefully, at the end result, lower people's blood pressures.
The importance of this actually resonates with me as I most recently was diagnosed with hypertension. And I do have a history in my family, and so this is something that I'm quite passionate about, not only for myself, but knowing how I went for so many years not knowing and thought that I was healthy because I was an athlete, but realizing that there's more to it.
My name is Barb Ducharme. I'm the Senior Director of Community Health for the American Heart Association in the state of Minnesota. One of the things that we know is that stroke in particular is much more prevalent in the African American community. And there's a lot of different factors that go into that, but healthy living can help, you know, lessen the chances of people having heart and stroke issues. So what we're trying to do through this 3-month project is to show people that, you know, if you do have high blood pressure, yes, you need to go to your doctor, you need to get a treatment plan, but some ways you can help naturally reduce blood pressure is by eating better and by exercising more, and this obviously is the exercise piece.
Line dancing is very important because it strengthens your heart, it gives us a good time to socialize with everyone, and it's good for your mind, it's good for your memory. Tonight we will be learning several different soul line dances. We kind of start with more beginner line dances, and then we advance and do a little harder as the night goes on.
Well, I started the night by finishing some CPR certification training for some of the people in the congregation, so I missed the first half of the dance, but now I'm having the opportunity to watch some people doing some line dancing, having a lot of fun, getting some good heart pumping exercise, so it's been a lot of fun.
And we just had a good time. We socialized, we danced, we ate, we had a good time. And this time I'm expecting even more people to show up. More people have been hearing about it, so we're gonna have a good turnout.
I'm Heather Raybon, and I am part of Shiloh Missionary Baptist Health and Wellness Committee. And today we have been preparing food in a healthy manner. We went and we used some of our cookbooks out of our American Heart Association cookbook. We want to teach our community as well as our members how to prepare healthy, good meals, but still have them taste good. So today they were all hands-on. So all I did was pretty much direct them. So this is all their creation. I let them season to taste. I just kind of brought a lot of fresh herbs, a lot of fresh seasonings, low fats, good fats, you know, versus bad fats. We did a lot of trimming off some of the fat foods, like the pork chop. We did some cut back on that. So we're trying to watch our fat, watch our sodium, and produce some really good meals.
Today I'm here participating in the Heart 360 Health and Cooking class. I'm here with my daughter. She's 9 years old, and I wanted her to experience some healthy eating. I'm trying to instill that in her at a young age. I wish when I was younger I had somebody do that for me. So, you know, I could have grew up knowing the importance of eating healthy instead of trying to do it now at the age that I am now. If it had been a part of me growing up, you know, who knows?
Hi, I'm Ariana Giles, and I'm a member of Shiloh, and I'm here for a cooking class for Heart 360. I think it's important because when I get older, I'm probably going to have a family of my own, and I should be able to learn how to cook and know how to cook for them in the right way and the healthy way.
Today helped me to learn just watching all the different cooks, especially when they were talking about the pork, for the people that are cooking the pork dish, not to use the extra oil, you know, just to put it in the pan with Pam instead of using oil like I normally would have done. So just cutting out all that extra fat.
My name is Patricia Jones. I attend Shiloh Missionary Baptist Church. I am a part of the Health Wellness Auxiliary. Today was exciting and educational. It taught more about the extent of the knowledge of a heart disease, a disease that we know very little about and need to be educated. It is important about your blood flow, the content of your balanced meals, your family history. They play a very important part on all parts of your body. If you don't understand it, you can get caught up and be very ill for a long time. Take a lot of medications and never get ill, well, or just get ill and die. So it's very educational.
Hi, I'm Andrea Silverman, and I'm the Administrative Director for the Cardiovascular Division in the medical school, as well as for the Lilly High Heart Institute here at the University of Minnesota. The importance of this tour is several-fold. First of all, we were able to provide context to the history of the University of Minnesota and its importance to the prevention and the treatment of heart disease. And I think Dr. Gary did a very nice job providing the overview of all of the firsts that have occurred here at the University of Minnesota. I think secondly, what we were able to do in this tour is to give individuals a snapshot of the kind of research and the depth and the breadth of that research as it relates to cardiovascular disease. And I think finally we were able to also give a sense about what we're doing not only in the world of prevention, both some more simple kinds of interventions like the statewide partnership prevention study and that Dr. Hirsch talked about using aspirin as the intervention, as well as the Rasmussen Prevention Program that gave an overview of the testing that's done to give individuals who don't already have a diagnosis of heart disease a sense of a sort of an early window into whether they do have the beginnings of heart disease. We went from that to understanding and seeing the state-of-the-art imaging center, which gave individuals here a sense of the kind of imaging that is done to diagnose and assess heart disease. And finally, the Minnesota Resuscitation Consortium was able to provide the kind of information where they're working with the state of Minnesota to decrease the sudden death, sudden cardiac arrest through education across the state, education through our schools, and through various institutions such as churches. So I think overall the importance of this is to show the individuals that it's a multi-pronged approach that we're taking here at the University of Minnesota.
So at the initial onset of this study, we wanted to do things that would engage the normal person to basically understand what exercise is, some of the simple forms of exercise, and have fun. And so we started out with line dancing, and we've actually done several lessons, and to the surprise of many, they have learned much more than they ever thought. In the meantime, we spend about 2 hours dancing, and every 15 minutes they're burning 100 calories. So quite an amazement to most of them, but in the same tone, they're having fun. So today we actually had the opportunity to see what it looks like when we don't get that exercise, and when things don't function properly in the body regarding the high blood pressure that most African Americans have, cardiovascular disease, just understanding what's being done and some of the other things that really factor in terms of when you don't eat right, when you don't pay attention to your history, and if you ignore it, what the results are. Because we know that we have longevity if we do adhere to the knowledge and the awareness and understanding that we hope this program has brought most. So underlying all of that, we also did some healthy cooking. And so what we put in our bodies is very important. And so I think we've done a great job in terms of just giving everyone insight into how we can change our lifestyle. We're grateful for the American Heart Association, having partnered with them and for them to have chosen our community to do this study, because in the whole state of Minnesota they could have chosen anywhere. And through this, we hope that not only have we serviced them in their research and in their study and understanding what the blood pressures are, who has them, why they don't get it taken, when they do get it taken and they're on medication, what happens. Just all of that factors into this study and giving them understanding and giving us understanding so that the studies that we see, they're not generalized, they reflect exactly the community that it's intended for.